Here are some alternative treatment options for mesothelioma that are being studied or used in addition to standard therapies like surgery, chemotherapy, and radiation. Immunotherapy. Immunotherapy aims to boost the body's natural defenses to fight cancer. It works by modifying or stimulating immune cells to recognize and attack cancer cells more effectively. For mesothelioma, immunotherapy drugs under research include checkpoint inhibitors, cancer vaccines, and CAR T-cell therapy. Checkpoint inhibitors like nivolumab have shown some promise in early-stage clinical trials for mesothelioma. They work by taking the brakes off T cells to allow them to better target cancer cells. Cancer vaccines are also being tested to stimulate an immune response against mesothelioma tumor antigens. Some early results suggest these approaches may help extend survival when used with standard treatments for some patients. Larger studies are still needed. Gene therapy. Gene therapy seeks to introduce new genetic material into patients' cells to fight cancer. For mesothelioma, researchers are testing strategies like inserting tumor suppressor genes to slow tumor growth or immunomodulatory genes to stimulate anti-tumor immune responses. Oncolytic viruses genetically modified to infect and destroy cancer cells while leaving normal cells unharmed are another gene therapy approach in early trials. This works by infecting mesothelioma tumors with a virus that replicates inside the cancer cells and causes them to rupture, while stimulating anti-tumor immunity. More research is still needed, but gene therapies hold promise as a future alternative or add-on treatment. Cryotherapy. Cryotherapy, also called cryoablation, uses extreme cold produced by liquid nitrogen to freeze and destroy cancer cells. It may be used to treat small, localized tumors not amenable to surgery. A thin hollow needle or probe is inserted through the skin and precisely guided into the tumor under imaging guidance like CT scans. Liquid nitrogen is circulated through the needle, freezing the tumor without damaging surrounding tissues. As the tumor thaws, it dies and is absorbed by the body. For mesothelioma, cryotherapy is being studied combined with radiation or chemotherapy as an alternative local treatment when surgery is not possible due to tumor location or stage. Early research shows cryotherapy may help control tumors when other options aren't available. High-intensity focused ultrasound, HIFU. HIFU utilizes ultrasonic energy focused as high-intensity sound waves to precisely elevate the temperature in a localized area of the body and destroy cancerous tissue through ablation or coagulation necrosis. For mesothelioma tumors in certain locations, HIFU is being explored as a non-invasive local therapy that can be guided by imaging to target tumor tissue without harming adjacent structures. No incision is required. The intense ultrasound heats and kills cancer cells while sparing surrounding healthy tissue. Research so far shows promise for HIFU as an alternative to surgery or other local treatments. Challenges include ensuring reliable tumor targeting through imaging guidance, and further study is ongoing. Photodynamic therapy, PDT. PDT employs photosensitizing drugs activated by a non-thermal laser light of a specific wavelength to selectively damage malignant cells. The photosensitizing drug such as porphyrin sodium or delaporphin accumulates preferentially in cancer tissue. A laser is then used to activate the drug at the tumor site, which triggers oxygen-dependent reactions producing reactive oxygen species that destroy cancer cells through necrosis or apoptosis. For mesothelioma, early research suggests PDT may help control localized pleural tumors when combined with other therapies. Clinical trials are exploring its safety and effectiveness as an alternative local cancer treatment or to augment standard therapies. Benefits may include minimal invasiveness and ability to treat difficult-to-access tumor sites under image guidance. More research is still warranted. Traditional Chinese medicine, TCM. TCM practices like herbal medicine, acupuncture, and nutrition, lifestyle changes are being explored as potential complementary or alternative adjunct therapies for mesothelioma. Herbs commonly used in TCM formulations for cancer such as Astragalus membranosus or Oldenlandia diffusa have shown anti-tumor activity in preclinical research and are being studied for mesothelioma. Acupuncture aims to stimulate specific points on the body to relieve side effects from disease and treatment and boost general wellness and immunity. Dietary and supplementation approaches emphasize anti-inflammatory whole foods and herbs to support the body's natural defenses. While definitive evidence is lacking, some preliminary studies suggest integrated TCM alongside standard therapies may help extend survival or improve quality of life for certain patients. More research with larger trials is still needed. While standard multimodal treatment continues to be the primary recommended approach, some of these alternative treatment strategies are showing early promise as emerging options either in combination with or as an adjunct to standard therapies. Immunotherapies, gene therapies, cryotherapy, HIFU, PDT, and select areas of traditional Chinese medicine, specifically acupuncture and herbal interventions, represent treatment modalities that are currently being evaluated in clinical research settings alone or in combination for patients with malignant mesothelioma. Their potential roles as future mainstream or complementary therapies remains to be fully defined, but they offer hope for more options beyond current standard of care alone. Further investigation through well-designed clinical trials will help establish their safety, efficacy, and appropriate incorporation, if any, into care algorithms.